I'm Dr. Eppley, plastic surgeon of Indianapolis, and I wanted to spend a few minutes talking to you about brow lift surgery. As one ages, one often develops excess skin and fat around the eyelids, as well as the brow may well come down beneath the brow bone. One may also develop horizontal wrinkles or lines in the forehead, as well as some vertical lines between the eyebrows. All of this is evidence that one has some aging of the brow and forehead area as well. Now, brow lift surgery, although it can be done as an isolated procedure, is most commonly done in conjunction with blepharoplasty or eyelid surgery. The most common scenario would be either upper and lower eyelids done together with a brow lifting procedure, creating an overall rejuvenating effect to the forehead area. This is something where you have to sit down with your plastic surgeon and go over in detail whether you should have brow lift and eyelid surgery done together, or whether you really don't need to have your eyelids done at all. But as we talk about brow lift surgery, there are different ways to do a brow lift, and certainly whether one is a male or female can influence what type of brow lift procedure is done. The two most common ways that brow lift surgery is done is either through a closed or endoscopic approach or an open approach. In the endoscopic approach, 2 or 4 small incisions are made in the scalp area, and the forehead is raised, and using a camera, one comes down to the brow area, releases the tissue over the brow area, as well as removes some of the muscle in between the eyebrow area. The forehead tissue is then lifted up and sewn to the bone in a variety of ways, most often using resorbable screws or sutures to fix the forehead tissue up higher. Understand that in an endoscopic brow lift, while it is very appealing, having very small incisions, it is not a procedure that is for everyone. One of the sequelae of an endoscopic brow lift is that your forehead is really going to get longer. The distance between your eyebrows and your hairline is going to increase in distance, because an endoscopic brow lift is really what I call an epicranial shift. You're simply shifting the forehead tissue up and back, and with that the hairline goes back. So for those patients who have a long forehead to begin with, an endoscopic procedure may produce this unsatisfactory lengthening of the forehead. In addition, an endoscopic lift is not the best approach to decreasing the muscle action, particularly between the eyebrow areas. While you can remove some muscle through the endoscope, you're not going to be as effective doing that as one would do in an open approach. Endoscopic brow lifts tend to be used for those patients who are younger, who have smaller amounts of brow sagging or lowering of the brows, and not an excessive amount of heavy muscle action or lines and wrinkles throughout the forehead and between the eyebrow area. The other alternative is going to be an open brow lift. This is where an incision is made across the top of the head or along the hairline. The forehead tissue is moved down, and through a wide open exposure, the tissue is released, muscle is removed, and then the forehead is redraped up, excess skin is removed, and closure is then done. With the two approaches of an open, the traditional and older form of a scalp approach, where it is placed across the top of the head behind the hairline, you do run into the same issue as with an endoscopic approach, in that you are going to lengthen the forehead. Plus, you are going to have a lot more numbness in the back part of your scalp as a result of that procedure. That tends to not be the approach that I most commonly use today. The other alternative is going to be a hairline or a pre-tracheal open brow lift, where you make an incision along the hairline. In this way, when you close, you do not lengthen the forehead, and you do create a little bit less numbness back in the scalp area, but you get all of the benefits of being able to see down to the muscle area to adequately remove the amount of muscle that you need. The open brow lift is only good, particularly at the hairline area, if you have a good density of hair along the frontal hairline. So if your hair is very thin, if you have recession in that area, then putting a scar across that area may not be good. Now for men, brow lifting becomes a completely different story, and it's fair to say there is much less brow lift surgery done in men than women for an obvious reason. The whole issue of the hairline becomes very significant. Most men cannot really have any of the traditional open brow lift procedures. Some men with reasonable hairlines may be able to have an endoscopic approach, but most men that I do, the brow lift is done through what we call a direct or an upper eyelid approach. At the time of their upper eyelid surgery, one comes in from below, releases the tissue and a little muscle, and then sews the brow up from underneath. This doesn't create as much lift upward as one would have in a traditional open brow lift, but for most men, they're not looking for a dramatic change in their brow position anyway. This avoids any type of scar near their hairline, which for most men is usually advantageous. While this can be done also for women, their hairlines and hair density patterns are usually much more favorable to an approach from above. So as you can see, brow lifting surgery and the considerations for it may be a little more complex than what you may have thought. This is why you really need to have a good in-depth consultation with your plastic surgeon to figure out whether you need a brow lift and what type of brow lift might be best for you. I'm Dr. Eppley, plastic surgeon of Indianapolis, and I wish you the best on your brow lifting experience.